Hello and welcome, everybody. Thank you very much for tuning in. I am Lucas Tietzen, and this is Blues News Media. Now, today we're going to talk about a topic that everybody knew was coming. Doesn't matter your political preferences or your viewpoints on the pandemic/plandemic, the CDC, the World Health Organization's global health authorities were whispering with deadly intent the threat of a second wave all the way back in January. We knew it was coming. We've been mentally prepared. And I think there's a good reason for that. But instead of the CDC and the World Health Organization with their general fear-mongering saying that it's coming, people in the alternative media realm mainly focused on how it was going to be worse, not in the sense of the disease will be more widespread, there'll be more cases, they'll be deadlier, which I don't trust any of those numbers as far as I can throw them. It's going to be deadlier. It's going to be way worse in the sense that the things that they're going to try to push through will have an even more legitimate excuse. The forcing of wearing face masks or forced testing, forced vaccinations, mandatory lockdowns, contact tracing, immunity passports. These are all items on the agenda of the global powers that shouldn't be, that they intend to push through coming at the end of this year even. But first things first, we're going to go over the emerging second wave ever since the massive protests/riots have died down. They've started to ramp up the fear on the coronavirus front once again. And that's why, to start us out with, I have this article here called Beijing Coronavirus Second Wave. Massive quarantine measures in place amid extremely grave situation. Right off the bat, China is implementing another lockdown at the threat of this second emerging wave. But the article opens with, after a nearly 2-month stretch of time with no new cases of COVID-19 reported, a new outbreak in Beijing, the capital city of the People's Republic of China, is raising concerns and prompting a quick response from the authorities. One Communist Party official, Kai Qi, if I'm pronouncing that right, described the situation in Beijing as extremely grave, and that the new surge in cases truly rang alarm bells, like it will every time with the third wave and the fourth wave that is sure to be on its way. About 150 new cases in recent days have sent 29 communities back to lockdown status. The outbreak is eerily like the original outbreak in Wuhan that occurred in January and was linked to a large food market. Authorities were quick to react. Let's see some of the beautiful measures that we should look to our brave brothers and sisters over in China are doing. They erected barricades to isolate neighborhoods known to have infected people. That's not horrifying. A massive testing campaign began. Forced testing. First targeted were workers and visitors at the Xingfadi wholesale market, estimated at 200,000 people, plus another 90,000 residents who live in surrounding neighborhoods to the market. It's a lot of people to round up to test. Massive housing blocks were placed under quarantine, and food deliveries were blocked from going no further than perimeter roadblocks. So they are halting the movement of food as well. Taxis and ride-sharing services have also been banned from taking people outside the city, and those had already left were ordered to report to local health officials as soon as possible. Kind of like how in New York, when a contact tracer messages you, you are supposed to check in with them. So we can see the similar models there. And on Wednesday, June 17th, China canceled hundreds of flights to and from its capital. And they were able to just stop movement at a moment's notice. And now this is starting in Beijing. Maybe not the original place of the first emerging of the coronavirus, which was in Wuhan. But nonetheless, it would make sense. Beijing seeing its second wave, and you bet your bottom dollar it's coming to America. We already see that happening. I mean, we see these surges happening in Texas and Florida, and I'm sure without a doubt, people to be blamed are the protesters. We really need to rethink our Bill of Rights. They're not appropriate for a coronavirus and post-coronavirus world. Free speech? Well, you can spread bad information. That needs to be stopped. Can't practice religion so much because that requires congregating in a small enclosed area. Definitely freedom of assembly is out. I mean, could you imagine a bunch of people getting together? The virus could spread so quickly. Freedom of the press, well, that's risky too. I mean, they could report on what people might be saying freely. This is unacceptable. Surely they're going to start coming after our most basic rights with the new emerging second wave that is coming. And from AP News, even right here, United States virus outbreak stir clash over masks, personal freedom. Now in this article, what it mainly talks about is the mandatory requirement of wearing a mask and if that infringes on your personal freedom. In my opinion, I think if you want to wear a mask, that's totally fine. That is up to you. That is within your right. But it's also within somebody's right to decline to wear a mask. I mean, that's just my opinion. The things that I've been looking at says that masks don't do a hell of a lot of good. I think it's more social conditioning. They can get you to wear a mask first. Well, then what's next? Mandatory testing? Mandatory vaccines? It's a slippery slope. In a perfect world, you might be able to agree to some of this stuff. But anybody with one eye open realizes that there are corrupt, criminal, sociopathic people at the top of society, of the power structure. And I will not budge even a little bit of giving up my own personal medical freedom to these freaks. But we see now personal freedom is at risk. We need to call into question, what does it mean to be free in a world where we need to be concerned about every little virus, every death? It's something to look out after, and it's very scary. And I think we need to do an episode specifically about what are some of the things that they are trying to push for, i.e. the contact tracing, the mandatory medical martial law type things. So that should be in the works. But unfortunately, they have been very successful in their fear campaign, especially at the onstart of all this. People were afraid, people were horrified, and I've admitted I was one of those people. Unfortunately, a lot of people, once they got into that state of fear, either from still being horrified or just cannot admitting they were wrong, they got something wrong. There has been a cult around this coronavirus where you are praised for being afraid. And we can see that in this here poll. Americans worry about second wave of coronavirus. And I've been seeing this a lot with people too. But the article opens here with 80% of Americans say they are concerned about a second wave of the coronavirus, according to a new poll. 11% say they are not very concerned, and 6% say they are not concerned at all. But 80% of Americans are concerned. 4 out of 5 people are worried. That is a great majority. But the results go on with 85% say they are likely to social distance in the event of a second wave, compared to 14% who say they are not likely to. And I feel like social distancing, I know, again, there's more evidence to show that it is not effective at all. It's more of just social conditioning, pushing yourself away from your fellow humans, severing that beautiful connection you can have with not just your loved ones, but with random strangers, random people. it's a very wicked, wicked thing they have done. 79% say they will likely stop having gatherings with friends and family if there's a second wave, while 20% say they will not likely stop. 77% they will keep their child from school and childcare in the event of a second wave, compared to 20% who say they will not likely do so. So at least there is some positive news there. Get your children out of these state-run indoctrination camps. I mean, I went through state schools, and for the most part, it was fine, but early on, I became privy to a lot of the actual history that was going on, so I was able to take everything with a grain of salt, whatever they fed me. And I can only imagine how terrible it is now. I've reported about the terrible circumstances they're going to subject our children to, this horrifying psychological and somewhat physical trauma of not being able to leave your seat or communicate directly to your own friends. It's sickening. It's sickening. But yet some people are praising these solutions, which aren't solutions at all. 73% say they will likely stop going to non-grocery store, retail stores if there is a second wave, while 26% they will likely not stop. 73% will not go to other stores. That is going to even more so destroy the U.S. economy. That is going to lead to even more unemployment. This is going to be disastrous. It's already bad, but we have not seen anything yet. They just now kicked this little snowball down the hill, and it's got about a mile to go. And then lastly here it says 65% say they will likely self-quarantine in the event of a second wave, compared to 33% who say they will not. And you know what? That 65%, that is within your right to do so. But it is not within your right to tell people what to do. Now, with the talk of this second wave, there's always talks of the big solution, the Mac Daddy solution, the solution that is going to just fix everything and basically bring us to a normal, not normal, but the new, fancy, shiny, new normal. They're going to develop a vaccine, which is very funny because some people stand to make hundreds of billions of dollars if there is even just one made for every single person on the planet. That's billions of dollars that is set to be made from the result of this crisis. And instead of making this this miracle serum vaccine, we could always just focus on maybe treatment. But that's ridiculous. There's not as much money to be made in that. And that's why we see, from here, NBC News, World Health Organization halts hydrochloroquine study. It opens with, the World Health Organization has halted research on whether hydrochloroquine could be an effective treatment for COVID-19. Multiple studies have shown that the drug, an anti-malarial medicine, also used to treat lupus and rheumatoid arthritis, has no impact on the coronavirus. The World Health Organization said in a statement Wednesday that recent findings, quote, show that hydrochloroquine does not result in the reduction of mortality of hospitalized COVID-19 patients. The decision will not affect other research examining whether hydrochloroquine might be beneficial to prevent COVID-19 or for patients after the recovery from the virus. So far, only one drug, remdesivir, I'm terrible at pronouncing these, has been shown in clinical trials to help very sick patients in the hospital recover faster. And Tuesday, researchers at the University of Oxford in England reported that a commonly used steroid called dexamethasone can help COVID-19 patients on ventilators survive the illness, although the data from the trial have not been made public. Again, I don't know about you, the World Health Organization has been caught lying to us so many times. And maybe you could make the argument that, well, at the onset of all this, we didn't know, there wasn't enough information. They were going off of what they thought. Well, then I would rebut with, why the hell did they speak in such certainties? They spoke so confidently that it could spread easily by standing next to your fellow human being, especially asymptomatic people. Remember the super spreader scare that they were rolling out in February, early March? Everybody's asymptomatic, 80% of people, in fact. And those people are the ones spreading the virus. And then it comes out there are many studies showing that asymptomatic people do not spread the virus easily. So they lied to us. They told us that it spreads easily from surfaces. It lives a long time on surfaces. And then the CDC comes out and admits itself, oh, just kidding. Actually, it doesn't spread that easily from touching a surface and then touching your face. So we were lied to again. The World Health Organization, and that's just this one, the World Health Organization has been caught lying to the general public for decades. For decades. So why in the hell should we start believing them now? It just boggles my mind, people's blind acceptance to believe scientists, people in the holy robes, the white lab coats, because apparently they are better than us. They have no personal agendas. They have no reason to fudge numbers or results, and especially people with big bags of money dropping it in their hands could never ever influence them. Give me a break. But the World Health Organization says hydrochloroquine, bupkis, it's nothing, don't worry about it. But then we see this article here. This came out back in late April. But I think it's interesting in and of itself. The article is from the Daily Mail, and it says, U.S. doctors claim that Trump's controversial hydrochloroquine drug does help 91% of coronavirus patients and argue we should not wait for controlled trials. And we see this a lot. A lot of doctors on the ground actually treating people were saying that the hydrochloroquine was a great way to treat the coronavirus. It didn't say that, oh, it's really good at preventing it or anything like that, like a lot of people were trying to frame it. It was really good at treating symptoms, which I think is what we would want to strive for. So I am more inclined to believe normal doctors on the ground, and sure, doctors can be persuaded and lied to also, but when you have such an overwhelming amount across the country saying that this works, I'm more inclined to believe that than a strong, central, global institution that can easily benefit, at least boost their own legitimacy, saying, oh look, we know what we're talking about. So don't trust the World Health Organization. I think hydrochloroquine, from what I've been able to see, what I've been able to find, is actually effective. But hey, maybe you don't want to use that. Maybe you are still holding out for that beautiful snake oil magic serum that these lovely people are going to inject into your arm, if you're lucky. With how the tests go through your nose, I'm sure they'll find a more insidious way to have to administer it if they wanted to. But we have this here. Operation Warp Speed officials deflect criticism. We are taking every possible step for safe COVID-19 vaccine. I'm sure this is going to satiate the normies out there. You see, I know that they say it takes about 10 years to develop a vaccine and make sure that there are long enough trials to make sure there is no long-time health implications, and that they're going to do it in a fraction of the time, in less than a year. Though that sounds scary, it sounds ridiculous. The government says they're taking all precautions. You crazy conspiracy theorists. They wouldn't try to rush out a magic serum just so they can capitalize on all the fear and make billions of dollars. What are you, insane? Nonetheless, the article opens with, the Trump administration is taking every possible step to maximize the likelihood there will be a safe, effective vaccine against COVID-19 available by the first of next year, administration officials said Tuesday. Speaking to reporters on condition of background, two leading members of the administration's Operation Warp Speed effort pledged safety would not be sacrificed in the push to quickly develop, manufacture, and deliver a vaccine. All of the professionals working on Operation Warp Speed see this as a solemn obligation to make sure these vaccines are safe and effective, one official said. The administration is on the defensive after accusations that Operation Warp Speed is going too fast and raising the anxiety level of people already hesitant to get vaccinated. Surveys show only about half of Americans would be willing to take a vaccine against the virus, although experts generally agree widespread vaccination will be needed to stop the spread. See, they're admitting it. Not only do they admit a lot of people are very scared and skeptical about the rushing of a vaccine, we still need to make sure the majority of the population gets it, which means they will try to force it upon you. They will try to force it. And as we know, big boy Papa Trump was saying earlier that the first people to get vaccinated will be the elderly and the frontline medical personnel. But the military would be the ones administering it. Are you really going to sit there and say no to a man that you know, America, will be toting a gun with a needle in his hand? It's going to be scary. That's why we need to have a national conversation about this. We just need to talk about this. And people need to stop that shaming and conspiracy-minded tactic of being like, oh, you're one of those people that questions the safety of vaccines. You must be an anti-vaxxer. Personally, I'm not an anti-vaxxer. I've gotten all my vaccines when I was a kid. My kid gets their vaccines. But I certainly don't trust this vaccine that is being rushed under these circumstances. It's insane. It's mind-boggling. And we need to have a discussion about it. But article goes on with, vaccine supporters said Tuesday they were glad to hear confirmation the federal process will focus on safety, team government. I hope it translates to a redoubled commitment for adequately testing the efficacy and safety of these vaccine candidates, said Dr. Peter Hotz, Dean of the National School of Tropical Medicine at the Baylor College of Medicine in Texas. Ensuring that the COVID-19 vaccine program will adhere to the highest standards of vaccine testing is the best means to diffuse anti-vaccine misinformation, which is now pervasive. Or, as I like to call it, people are actually now giving a damn and looking into vaccines instead of just accepting blindly what they are told from the cult of science and the holy priests at the upper echelons of that society. It's not crazy to question things. That's all I'm trying to get across. It's not crazy to see what is going on and say, hey, I don't like this. I'm not just going to accept it. But as we wrap up this episode, basically went over everything that I wanted to, but I really want to drive home this vaccine. It is going to be dangerous. It is being rushed way too fast. And not only are they going to try to push it upon you and me, dear listener, we already know who they are for sure going to give it to, even if we do try to stop this, even if we do push back hard enough and are able to maintain some semblance of medical freedom. They're going to come after the elderly. They're going to go after the frontline healthcare workers. And this is from military.com. They're going to come after the troops. And this says U.S. troops would be among first to get a working COVID-19 vaccine, officials say. Not only will they be administering it, but they're going to get it first themselves. It opens with U.S. service members would be among the first Americans to receive the vaccine against COVID-19 if one is proven to be safe and effective, senior administration officials told reporters Tuesday. And I don't care if they think it's safe or not. If I'll have to find Whitney Webb, who works for The Last American Vagabond. Great reporter, great website, highly recommended. But she just came out with a series of articles that went into vaccines and the big pharma world, and it certainly showed the little regard that they had for troops with the anthrax vaccine. I'll try and find that and link it up in the show notes for everybody to give it a read. It is just chock full of good information. Article goes on with, speaking about the Trump administration's effort to develop, make, and distribute a working vaccine against the deadly coronavirus by early next year, officials said those will likely to receive it first include the most vulnerable, such as the elderly, those with underlying health conditions, very broad, workers in essential businesses. Would that essential business even include your local grocery store cashier? And the United States military, the people that Trump himself has said can be the ones, possibly be the ones, administering the magic serum in tandem with the National Guard that will be helping with contact tracing. But there you go. Anybody that is in the Army, watch out. Share this information. Refuse this vaccine. You have rights. You do not have to take this forced upon magic serum. You do not have to force it upon other people. You are a human being. Your life matters. Your rights matter. What you want to do with your body matters. Just because these people in these fabricated institutions of power say you have to do this, you have to do that, it's right, it's what needs to be done, does not mean you need to do it. We need to talk about this. We need to stand up. And we also need to spread this information. And that is why we do it. And I hope you enjoy this content, because I certainly enjoy making it. I enjoy researching. It's a lot of fun. So I hope you have fun with it too. But that does just about wrap everything up that I had planned for you today. If you can, please like, share, subscribe this video or just the articles that are involved with it. Anything and everything that you can do to help spread and grow this show and spread this information is greatly appreciated. And as always, you can find us on the corporate-controlled platforms of Facebook, Twitter, and YouTube. Some of the more freer places you can find us are BitChute, Library, and Minds. Please make sure to go find us on all of those and follow our work there as well. And as always, listeners, thank you very much for tuning in. I am Lucas Tietzen of Blues News Media, and if you do take one thing away from this, hopefully it'll be this: ignorance isn't bliss.